I went to school at the University of Alabama, Birmingham. I went there for medical school. From there, I went to the Virginia Commonwealth University in Richmond, Virginia, where I did my internal medicine training. Then after that, I went to the University of Maryland at Baltimore, and I completed my cardiology and electrophysiology fellowship. I wanted to become a doctor ever since I was in my 20s. I had a lot of family members that actually passed away. My mom passed away from heart problems. My sisters actually both passed away from heart problems as well. And ever since my family started having health issues, and I was pretty involved in the medical field at that point because I had to go to the hospitals a lot of times, it sparked an interest for me to help other people who are going through the similar situation that I was going through. There are a few things about Genesis that really attracted me here. One is it's a small community. It's a place where you can get to know people and get to know them on a personal level. The other thing about Genesis is that there are a lot of people here who are good people, who are hardworking people, who are really dedicated to their job. It's not only the physicians and nurses, but also just every other member of the staff here. And I found that everybody here was very polite, very courteous, very kind, and they treated one another with respect. Being a new patient in any hospital setting or any clinic setting can be very anxiety-provoking. You don't know who you're going to meet, how the staff is going to be, how your experience is going to be. I think the biggest thing and the most important thing about visiting our clinic for the first time is that we're going to make you feel welcome. We're going to make you feel like your time is very important to us, and that we spend time figuring out what's wrong with you and what's going on with you. The one thing that I do differently than other physicians may do when it comes to their approach to patient care is that I strongly believe in a team-based approach. I believe that I'm not here to tell you what to do. I'm here to guide you and help you along the way in this journey that we're both going through. I think it's really important that we both feel comfortable with the decisions that we make together. Particularly, I can remember one patient who had a lot of struggles with atrial fibrillation, and just for the sake of having the patient anonymous, we'll call him Randy. So Randy was an elderly gentleman. He was a very nice, pleasant gentleman, and he was very anxious about his atrial fibrillation. He was very worried about it, and we had gone through a lot of different treatment options in regards to atrial fibrillation. And ultimately, Randy and I, we met on a few occasions and we discussed our options. And I found that one of the most important things about talking with Randy was actually not necessarily the medical aspect, but reassuring him and giving him a sense of a peace of mind that can help him and help him stay at ease with his medical disease process that he had. And I've used that to for other patients, and I realized that it's not necessarily the disease that's the problem. It's how a patient sees the disease and deals with the disease that really can play a bigger role. So my favorite part about being a doctor is that I can wake up every morning and I can say that I am making a difference in someone's life. Growing up, I've always wanted to help people. I've always wanted to do good, do what's right. And I feel like every day I wake up, I have the opportunity to change someone's life, to help someone in their daily life, and hopefully help them for the better and help them feel better, help them live a better life, a happier life, a more productive life. And that gives me a lot of satisfaction.